from KXAN NBC Austin. This is your news on First Cast.
Well, many women opt to get their tubes tied after giving birth, even though it's easier and cheaper for a man to get a vasectomy. So why aren't more men doing it? Dr. Koushik Shaw joins us to tell us that. Good morning.
Good morning, Jenny.
All right, so we were just discussing this. There's a lot of myths associated with vasectomies. Tell us what some of the myths that men encounter or some of the beliefs they have that make them not want to go with the surgery.
Right, so first of all, men are just scared to get operated down below the belt. They're just afraid of what's going to happen down there. And in all honesty, basically a vasectomy involves two small incisions about the width of a pencil eraser head. So they're tiny incisions that heal up, and within a few months you can't even see the incisions. The second one is if there are any changes in sexual performance, erections, etc., and there are none. A third one, is there any changes to ejaculation? There are none. So in all essence, within just a few weeks of a vasectomy, there are really no telltale signs whatsoever.
But many men are just scared of going in there and getting any kind of surgery in that department.
Exactly. There are just a lot of misconceptions, and a lot of people are just frankly afraid unless they've got friends who have had a vasectomy that they can speak to.
What are we looking at right now?
Well, right there is a small incision. Again, it's about the width of a pencil eraser head, and that's made in the scrotum where we lift up the vas deferens, which is like a little thin piece of spaghetti. We clip the tubes on both sides and remove a segment in between.
So this is the before and after, so the clip, what you were just talking about, right?
Exactly, and you can use metal clips, you can tie them off, you can coagulate it with electrical energy, so there are many ways to do that. But that's what we do, and you can see it's just a small incision, and that's what we do, we tie off the tubes.
Pretty simple. So you were giving me some pretty incredible numbers. How many women get their tubes tied for the same purpose as you would get a vasectomy versus men that get vasectomies?
Right, so there are about 500,000 men a year that have a vasectomy. What's incredible is that 10 to 15 million women
after giving birth
have a tubal ligation, exactly, every year.
And it's harder to reverse a tubal ligation than it is to reverse a vasectomy.
Yeah, a tubal ligation is an excellent procedure, but it's done under general anesthesia. It's an intra-abdominal procedure, and basically it's very hard to reverse a tubal ligation in most cases, whereas again, a vasectomy is a 10 to 15 minute procedure in the office, a local anesthetic with a very low complication rate.
So it's very easy. So it's just really about getting these myths out of the way and saying, listen, you're not going to have any major problems, no long-term effects, and it's cheaper too. Is it cheaper in the long run?
It's about $700, anywhere from $500 to $700 for a vasectomy. Insurance usually pays for 80 to 100% of it, and so basically in most cases it's covered by your insurance.
And for a woman, it's much more.
It's several $1,000s usually to have tubal ligation done. And there's one other excellent fact in terms of sterilization rates and success rates. A condom is about 85 to 95% success. A oral birth control pill is about 95 to 99% success, and vasectomy or tubal ligation is about 99.9% successful. So it's safe and effective.
All right. Well, thank you very much for joining us this morning. Some good information. Appreciate it.
Great.
Thanks
Jenny.
Dr. Shaw.